We have challenges going forward with our program given the budget environment that we face. In our budget, we are having to look at different ways to cut the costs of the Medi-Cal program. We spend over $50 billion on Medi-Cal. Given the financial constraints, we have to look at reducing payments to providers, and that has implications on the availability of physician services, of other types of providers within the program. So our challenge is within this fiscal environment to make sure that we're continuing to provide high quality services, access to comprehensive healthcare services, even in this fiscal environment. We also have the challenge and the opportunity that healthcare reform is around the corner. And with healthcare reform, we have the opportunity to enroll millions more Californians onto the Medi-Cal program. And that's also going to create the challenge of making sure that there's available access to healthcare services to all our Medi-Cal beneficiaries. Under healthcare reform, we believe that we are not just going to have a better experience for the consumers and how they enroll into coverage, but they're going to also have a better experience in terms of their relationship with their providers. And that's going to occur over time as our managed care plans work with our providers to provide the right incentives to pay our providers for better coordinated care, for providing the right types of care. And this in turn is going to mean that our patients, our beneficiaries, will have a better experience with their providers because they'll be within a more accountable delivery system where the providers are more in charge of making sure that our patients are receiving the right care, that they're receiving care that's in a primary care setting rather than in an emergency room. The biggest implication of healthcare reform for the Department of Healthcare Services and the Medi-Cal program is that we are going to be serving over 2 million more Californians under the Medi-Cal program, taking our membership up to over 10 million individuals. That's really, really exciting to think that the reach that we are going to have within California on making sure that all low-income Californians have access to affordable healthcare coverage. But that exciting opportunity is a tremendous challenge to make sure that we have the right access to services. Do we have the right number of providers in the system to serve this expanded population? And so it's our challenge to make sure that we figure out ways to make sure that we have capacity and access to needed primary care, specialty care services within the system. And so we're working on ways to make sure that we can pay differently within the system and incentivize our providers to serve more Medi-Cal beneficiaries, work with our managed care health plans to better organize care and reduce costs for inpatient care so that we can attract more providers to provide outpatient services. I believe that the most important way that the Medi-Cal program can be improved is through the eligibility process. It's the lens that most Californians view Medi-Cal, is that it's a very complicated enrollment process. There are many barriers, whether it's the paper process, whether it's all the documentation, whether it's that you have to apply or a view that you have to apply in person. And if we can break down those barriers and make sure that come healthcare reform that everyone understands that the Medi-Cal program and the enrollment process is very different, that we will have an online enrollment process where they will not need to provide documentation, where they can do all the application similar to a TurboTax without ever having to interact in person or on the phone, that this will really change the consumer experience and really help improve the Medi-Cal program.